You've done everything right. You bought the device that the pharmacy recommended, sat in the chair, rested your arm on the kitchen table, and wrote down the number. 135 by 85. Then 140 by 90. You called your worried son, went to the emergency room, and walked out with a blue paper in your hand and a silent sentence in your head. But what I'm going to tell you now can dismantle this whole scene. Because there's a real chance that your blood pressure isn't even close to that number you've written down so carefully. And it's not because of a failure of the device. It is because of a set of mistakes that happen in silence, repeated every single day, and that turn healthy people into sick people on paper. People who start taking medicine for a disease that may not even exist in the way it was diagnosed. Blood pressure measurement, the way most people do it, is a blurry photograph of an event that changes every second. And the number you have stored in your bedside drawer may be the reflection of a mistake, not a sentence. And if I tell you that value of 120 by 8, the famous 12 by 8 that everyone repeats as a sacred goal, is a dangerous lie for a huge portion of the population over 50. Not because the number is false, but because the goal has been generalized without considering what happens inside your arteries, inside your brain, inside your heart. And this will be very clear in the next few minutes. Think about the dimension of this. Millions of people wake up every day and take a pill based on a measurement that may have been completely skewed. The needle goes up, the diagnosis comes, the prescription is stamped, and no one has explained to you that the simple act of crossing your legs during the measurement can increase your systolic pressure by up to 8 millimeters of mercury. 8 millimeters. This is not a detail. It is a sentence written with a gesture that you make without thinking. You sit in the chair, cross your legs because it's more comfortable, because you've always done it that way, and at that exact moment your arteries are being compressed in a way that alters venous return, that changes the resistance that the heart needs to overcome, and the number goes up. That number that ends up in the medical record that will define whether you take medicine or not, whether you increase the dose or not, was inflated by a simple crossing of the legs. No one told you that a full bladder, that urge to go to the bathroom that you held back so as not to disturb the appointment, not to lose your turn, not to have to ask for permission, can raise this number by up to 15 millimeters of mercury. 15. It's as if you're measuring the pressure of a body in a state of alertness, a body that's receiving a primitive signal that something needs to be resolved, and that signal goes up the spinal cord, activates the sympathetic nervous system, constricts the vessels, and triggers the pressure. This is not an opinion. This is pure physiology, published, replicated, taught in medical schools, and completely ignored in everyday clinical practice. And when you understand that the difference between being classified as hypertensive and being considered healthy is often in a range of 5 to 10 points, you realize the seriousness of what is at stake. You realize that a diagnosis may have been given based on a measurement that was taken with a full bladder, legs crossed, arm drooping, and mind racing, a measure that has never been repeated, that has never been questioned, that has become a label that you carry to this day. The system didn't teach you how to measure. The system taught you to obey the number. And today, I'm going to show you the 10 errors that may be artificially inflating your values and the reason why 120 by 8 is not a universal truth. Let's walk together through mechanisms that the 15-minute consultation will never have time to reveal. We're going to get inside your arteries, inside your nervous system, inside the cascade of hormones that regulates your pressure every second. And I promise you that by the end of this video, you'll never look at a blood pressure device the same way again. Before we dive into the deeper mechanisms, I want you to keep two promises that this video is going to deliver. The first is that you'll understand why your ideal blood pressure changes after age 50, and why insisting on 12 by 8 may be dangerously reducing blood flow to your brain. And I'm not talking about a reduction that gives symptoms, a dizziness that you notice. I'm talking about a silent reduction. Micro areas of the brain that run out of oxygen, neurons that go out slowly, a light that goes down without you noticing, until the day the memory fails, the name escapes, the way home gets weird. All because someone decided that their pressure had to be 12 by 8 at any cost. The second promise is that you will discover a specific error that happens in the first 5 minutes before the measurement, and that completely nullifies the reliability of the number that appears on the screen. Most people have never heard of this error, and it will be the key for you to finally have real data about your condition. It's not a mistake in the device. It's not a mistake in the arm. It's an error that happens inside your brain, in the silent conversation between your cortex and your heart, and that no one, absolutely no one, has taught you to correct. Carry these two questions like flashlights. Why 12 by 8 can be a lie to me? And what is the silent mistake of the first 5 minutes that ruins everything? Now accompany me on a path of scientific authority. Don't be scared by the names I'm going to mention. They are anchors to let you know that what I'm saying is supported by decades of research and not by internet fads. In 2019, the journal Hypertension, one of the most respected publications in the world in the cardiovascular area, brought an extensive review on the variability of blood pressure. The researchers demonstrated that the pressure of the same individual can fluctuate up to 20 millimeters of mercury in a matter of minutes depending on factors that no one controls before measuring. 20 millimeters. That's the difference between being considered healthy and being diagnosed with stage 2 hypertension. It's the difference between leaving the office relieved or leaving with a prescription for medicine that you'll take for the rest of your life. The study highlights that the activation of the sympathetic nervous system, mediated by the release of noradrenaline in the synaptic clefts of the vessels, happens in seconds in the face of a simple stimulus such as speaking or hearing a high-pitched sound. Pay attention to this detail. In seconds. Norepinephrine is released. It binds to alpha-adrenergic receptors on the vessel wall, and these vessels contract. The internal space decreases, resistance increases, and pressure rises. This is not a defect of your body. It is a defense mechanism. It is your body preparing for a threat that does not even exist. But the problem is that this mechanism is triggered all the time by things you don't even notice. There's a tiny structure in your neck called the carotid sinus, located at the bifurcation of the common carotid artery, right there where you feel your pulse when you touch your finger. There reside baroreceptors that detect the pressure of the blood hitting the wall of the vessel and send electrical signals to the nucleus of the solitary tract in the brainstem. This nucleus, in turn, adjusts the force of contraction of the heart and the caliber of the arterioles with each beat. It's fine-tuning, beat by beat, a silent orchestra that happens inside you right now, as you listen to me. This system is so sensitive that the mere expectation of measuring blood pressure already triggers an alert response, a phenomenon we call white coat hypertension, but which is actually an actual activation of the hypothalamic pituitary adrenal axis with measurable cortisol release into the bloodstream. Cortisol, my friends, is not only the stress hormone, it is a molecule that messes with sodium, with fluid retention, with the sensitivity of the vessels to adrenaline. It's a cascade that starts with a thought and ends with an inflated number on the device's screen. And here's the first revelation that seems obvious once you understand it, but that scares you when you understand it deeply. Your body is not a bucket with a fixed level of pressure. It is a dynamic ocean with constant waves that respond to the environment, posture, emotional state, and a factor that almost everyone ignores: momentary peripheral vascular resistance, which is modulated by the endothelium, that very thin layer of cells that lines its vessels from the inside. The endothelium is not an inert pipe. It is a living organ. It is the largest endocrine organ in your body. It weighs about 1.5 kilograms if it were placed on a scale, and it releases nitric oxide to relax the arterial wall. When this endothelial cell is exposed to oxidative stress, low-grade inflammation, or glucose spikes, nitric oxide decreases, the vessel stiffens, and pressure rises. And this may be happening even if the blood tests you had last year came back normal. Your cholesterol may be normal, your blood glucose may be normal, but your endothelium may be screaming silently. The real enemy is not hypertension as an isolated number. The real enemy is silent endothelial dysfunction that erodes the ability of your vessels to dance to the music of your heart. And this dance, my friends, is not captured in a single measurement made in any way. She is not captured in the pharmacy, she is not captured in the hospital corridor, she is not captured in that 15-minute consultation when the doctor barely looked at her arm. Now I want to slow down with you. I want to connect all this data to your real life, the one you live when you turn off that video and go to the kitchen, to the bedroom, to the bathroom. Have you ever woken up in the morning with a heavy body, walked to the mirror, and seen a face that looked like it had aged 5 years overnight? The swollen eyes, the mark of the pillow on the skin that takes a long time to disappear, that feeling that sleep has not restored anything. Have you ever had that feeling that memory is failing for simple names, like that actress you've always liked or the street where you lived for 20 years? It goes blank. An emptiness, and you disguise it, change the subject, but inside you feel a chill down your spine, a fear that you don't dare name. Have you ever felt a tiredness that is not resolved with sleep? A tiredness that seems to come from inside your bones, a fatigue that makes you look at the stairs and think twice before climbing. And you thought, it must be age. It must be normal. Everyone my age feels it. Maybe it's not. Maybe it's your endothelium asking for help in a way that no routine exam can translate. Maybe that quick dizziness when you get up from the couch isn't just low blood pressure, but a failure to self-regulate cerebral blood flow, a dance your brain vessels can't keep up with. Brain self-regulation is a mechanism that keeps blood flow constant even when pressure varies, like a conductor who maintains rhythm even when the orchestra oscillates. But with aging, with arterial stiffness, with endothelial dysfunction, this conductor loses the baton, and with each getting up from the couch, the brain receives less blood than it needs. Not enough for a fainting, but enough for a silent injury that accumulates. Looking at these signs is not weakness. It is not giving in to old age. It is not becoming a hypochondriac. It's the opposite. It's taking possession of information that rightfully belongs to you. It's looking at your body and saying, I'm going to understand you. I'm going to listen to you. I'm not going to accept a number as a sentence without first asking the right questions. And it is with that respect that I look at you now and say, there is a real science-based way out. But to get there, we must first expose the mistakes that are telling you a lie about your own pressure. We need them one by one, calmly, with depth, the way your 15-minute consultation never allowed. Let us now go to the first cycle of progressive revelations. And I start with an element that is present in almost every Brazilian home and that, when used in the right way, can transform your measurement. Prior rest. That's right. Most people think that sitting down and measuring is enough. It is not. The guidelines of the Brazilian Society of Cardiology, aligned with those of the American Heart Association in 2018, recommend a rest of at least 5 minutes in a calm environment before the measurement. But the common mistake that nullifies this benefit is that people sit down, but continue with their minds racing, pick up their cell phones, talk to someone next to them, listen to television, dwell on a financial concern, reliving an argument they had yesterday. Any cognitive stimulus keeps the sympathetic nervous system activated. And the sympathetic nervous system doesn't shut down just because you sat down. He needs time. He needs real silence, a real truce. The actual physiological mechanism involves the reduction of the activity of circulating catecholamines, specifically adrenaline and noradrenaline, which need to be cleared from plasma in order for vascular tone to really stabilize. These molecules have a half-life, a time it takes for the body to remove them from circulation. Adrenaline has a half-life of about 2 to 3 minutes in the blood, but if you're active, your brain keeps sending orders to your adrenal glands to produce more. It's like trying to empty a bathtub with the faucet running. A study published in the Journal of Hypertension in 2200 showed that quiet rest, without visual or auditory stimuli, reduces systolic pressure by an average of 7 millimeters of mercury compared to rest with distractions. 7 millimeters. It's the difference that decides whether you'll leave the office with a prescription or a compliment. It is the difference between being labeled as sick or being recognized as someone who is on the right track. When you apply this in real life, what changes is that number that scared you on Monday can be replaced with a number that gives you peace on Tuesday, simply because you gave your body the time the baroreflex needs to recalibrate. The baroreflex, that system I mentioned of the carotid sinus, is like a thermostat. He needs a time without interference to find the point of balance. If you fiddle, talk, think about stressful things, you're poking the thermostat all the time and it never finds the real point. The patient, Mrs. Celia, 67 years old, came to me desperate because her morning blood pressure was always at 155. I asked her to describe exactly what she did before measuring. She would wake up, run to the kitchen, prepare coffee, argue with her husband about the electricity bill, turn on the television to the newspaper, sit down, and mediate. Her body was on a hormonal battlefield. I asked her to do an experiment. When she woke up, first of all, still in bed, she would be silent for 5 minutes, breathing slowly, and only then measure it. Her blood pressure dropped to 132. The body was not sick. The body was responding to a hostile environment. And now, before I show you the next mistake, which involves the position of your arm, I need to pause for a simple gesture of community. Those who are watching now have followed me here with the courage to question what has always been said as absolute truth. And I want to ask you something. tap the screen and leave your like as a sign that you are on this journey for the truth of your health. Subscribe to the channel because we still have much deeper revelations ahead, things that will completely change the way you understand your pressure. And I want to know from you. Write in the comments the city or country from which you are watching us, and a word that defines how you feel when you go to measure your blood pressure. Anxious, confident, suspicious, afraid of the number that will appear? I read every comment because I know that every city name is a human being who deserves that information. Each city is a life that can be transformed by knowledge that the system does not deliver. And now, answer me mentally. Have you ever stopped to think about whether your arm is at the right height when measuring pressure? Because that's what I'm going to talk about now, and what you're going to find out might surprise you deeply. The second mistake is the height of the arm in relation to the heart. And here's a new element, the level of the right atrium, which is the chamber of the heart, where blood returns after it has circulated through the body. The right atrium is in the center of your chest, about the level of your breastbone, that flat bone in the middle of your chest. The cuff, that armband, needs to be exactly at the height of your right atrium. Exactly. It's not approximately, it's not more or less, it is exactly, because pressure is a measure of force per area, and this force is influenced by gravity, by the column of liquid that is above or below the measurement point. The common mistake that voids the measurement is to leave the arm hanging down or too high on top of a slipping soft cushion. Most measure at the kitchen table with their arm dropping, with their elbow down, with their cuff down while their heart is up there. When the arm is below the heart, gravity increases the hydrostatic pressure in the brachial artery. It's pure physics. It's like diving to the bottom of a pool. The deeper it is, the greater the water pressure on you. Similarly, the lower the cuff is in the heart, the more pressure the blood will exert on the artery wall at that point. The actual physiological mechanism was demonstrated in a classic study by the British Medical Journal, one of the oldest and most respected medical journals in the world. The researchers showed that for every 2.5 centimeters that the arm is below the level of the heart, the systolic pressure rises by an average of 2 millimeters of mercury. This means that an arm dropped at the side of the body without support can add up to 15-20 points to your reading. 15 or 20 points. You went from normal to hypertensive because your arm was down. Think about what that means. It means that a person can have a real pressure of 125 by 80, but with his arm down, he measures 145 by 90. She receives a diagnosis of hypertension, starts taking medication, and her real blood pressure, which was normal, will now drop below normal because of the medication. She will feel dizzy, tired, she will think it is age, she will reduce activities, and it all started with a poorly positioned arm. The connection to real life is immediate. Think of those measurements in pharmacies, with you standing, arm outstretched down, talking to the clerk, the noise of the store around, the rush. That number is probably a dangerous fiction. Don't use that number to make decisions about your life. My patient, Mr. João Carlos, 64 years old, a retired driver, came to the office with a notebook full of measurements over 140. He was scared, his wife was scared, his children were charging. He was already taking 2 medications, and his blood pressure did not go down. I asked him to bring the device from home and measure it in front of me. He sat in the chair in the office, rested his arm on a cushion that I positioned precisely at the height of the sternum, adjusted the cuff, and asked him to be silent. We didn't speak for 6 minutes. His pressure was at 122 by 79. He looked at the device, looked at me, and his eyes filled with water. He told me, "Doctor, I spent 5 years afraid of dying, and it was my arm." 5 years. 5 years of fear, of medicines, of consultations, of sleepless nights, and the problem was literally the height of the arm. This story is no exception. This story is the rule. And this brings us to an even more surprising detail that many people don't consider, the size of the cuff. The third mistake is the inadequate size of the armband, and this is one of the most insidious details because you can be using a very expensive device from an excellent brand and still have completely false data. The new element here is the ratio between the circumference of the arm and the inflatable chamber that is inside the clamp. The inflatable chamber is the part that actually compresses the artery. If it's too short or too narrow in relation to your arm, it can't transmit pressure evenly, it can't occlude the brachial artery properly, and the device takes a wrong reading. The common mistake is to use the standard cuff that comes with the braces, usually designed for arms that are 27 to 34 inches in circumference, on an arm that is larger or smaller than that. And here is a fact that no one discloses. The circumference of the Brazilian arm is changing. The population is more overweight, and many elderly people have thinner arms due to loss of muscle mass, sarcopenia. If the cuff is too small for a wider arm, the inflatable chamber does not compress the brachial artery evenly, and the device needs to generate much more pressure to occlude the vessel, resulting in a falsely elevated reading. It's like trying to cover a thick pipe with a small cloth. You need to exert much more force, and the device interprets this extra force as if its pressure were higher. The actual physiological mechanism was quantified in an impactful study published in the American Journal of Hypertension in 2022. The researchers tested different cuff sizes on hundreds of participants and found that wearing an undersized cuff, i.e., too small for the arm, can overestimate systolic pressure by up to 20 millimeters of mercury. 20. I repeat the number so that it sticks in your memory. 20 millimeters of mercury because of the size of the clamp. And the opposite also happens. A cuff too big for a thin arm can underestimate the pressure, give a falsely low value, and the person thinks that everything is fine when it is not. In real life, what happens is that a lady with a thin arm, who has always been thin, or a man with the muscular arm of someone who has worked his whole life in the heavy, or someone who is overweight, receives a diagnosis of hypertension, and no one, at any time, has checked the circumference of the arm. No one took a tape measure and measured it. Dona Maria Helena, 71 years old, a retired teacher, came to me with a wrist device that she had been using for 3 years. The pressure was always high, always above 140. She was already taking 3 antihypertensive drugs. We measured the circumference of her wrist, chose the arm device with the appropriate cuff, rested correctly, and the pressure was normal. Normal. She had gone through 3 cardiologists. 3. In 3 different consultations, with 3 trained professionals, and none of them asked what device she used at home. None measured her arm. None asked her to bring the device for a comparative measurement. They simply increased the medication, stamped the prescription, and scheduled the return. The system treats the number, not the person. And the person of Mrs. Maria Helena was poisoned for 3 years by medicines that perhaps she did not even need. The question that keeps echoing in your head now is, what else is sabotaging your measure without you realizing it? And I'm going to answer this question now, because the 4th mistake involves something that you carry inside your body and that may be screaming without you listening. Your bladder. A full bladder is a powerful stimulant of the sympathetic nervous system, and I want you to understand what happens inside of you when the bladder is distended. The new element is the distension of the bladder wall, that muscular sac that stores urine. When it fills up, the smooth muscle fibers in the wall stretch, and stretch receptors, which are like tiny sensors, fire electrical signals. These signals travel through visceral afferent fibers that travel up the spinal cord, synapse in the brainstem, and activate nuclei that control the autonomic nervous system. The body interprets a full bladder as a state of alertness. It's a primitive mechanism. If you need to urinate, you need to find a safe place to do so, and the body prepares you for the action by raising the pressure, speeding up the heart, constricting the vessels. The common mistake is to think that holding back a little doesn't make a difference. You wake up, go to the bathroom, but then drink coffee, drink water, and when it's time to measure the bladder, it's already partially full again. Or worse, you're at the doctor's office, you arrived early, you drank liquid on the way, the appointment was delayed, and you stay there cramped, not wanting to ask to go to the bathroom. And then the doctor calls you, you sit down, he puts on the cuff, and measures it. Your bladder is full, your sympathetic system is firing, and the number that appears on the screen is a reflection of that. The actual physiological mechanism is a powerful autonomic response. Bladder distension sends signals to the vasomotor center in the medulla oblongata, which increases sympathetic discharge, which in turn constricts arterioles and increases peripheral resistance. At the same time, the heart is ordered to beat harder and faster. A study in the Korean Journal of Family Medicine, an Asian publication of great methodological rigor, showed that systolic pressure can be up to 15 millimeters of mercury higher with a full bladder. 15 millimeters. It is the same as the error of the fallen arm. It's the same as the coffee bug. The real-life scene is that doctor's appointment where you left home early, ate breakfast with liquid, braved traffic for 40 minutes, arrived at the office nervous, The receptionist rushed you. You sat down and the doctor already told you to reach out without even asking if you wanted to go to the bathroom. Your bladder was full. Your nervousness was 1,000. Your arm was probably drooping. You had just talked to the receptionist. The pressure came high. And then the recipe was written based on that moment, which is a sum of errors, a sum of factors that have nothing to do with your baseline cardiovascular condition. The pressure of that moment was the pressure of a body in a situation of stress, not the pressure of a body at rest. And the medicine you started taking was to treat a situation that might never exist if the measurement had been done correctly. Now, you'll discover something that very few doctors explain in their clinical routine, something that guidelines recommend but almost no one does. The pressure must be measured in both arms, and the difference between them can literally save your life. The fifth mistake is measuring in just one arm, and that's a revelation that can predict a vascular event before it happens, before you feel any symptoms. The new element is the interbrachial pressure difference, that is, the variation in values between the right and left arms. The two brachial arteries, one in each arm, exit the aorta artery, but by slightly different paths. The one on the right side comes out of the brachiocephalic trunk, the one on the left side comes directly from the aorta. If there is any obstruction, some fatty plaque, some calcification in one of these pathways, the pressure will be different in each arm. The common mistake is, for convenience, to always measure in the dominant arm or always in the same arm, usually the right arm, without ever comparing. You've been doing this for years. Everyone does. But this comparison is a window into the inside of their pots. The real physiological mechanism is that a persistent difference greater than 10 to 15 millimeters of mercury in systolic pressure between the arms may indicate a silent obstruction in the subclavian artery, which is the artery that carries blood to the arm. This obstruction does not hurt, it does not warn, but it is a sign that the same atherosclerotic disease is happening in other places, in the arteries of the heart, in the arteries of the brain. It is a marker of peripheral arterial disease and an independent risk factor for infarction and stroke. The journal The Lancet, one of the 5 largest medical journals on the planet, published in 2012 a robust meta-analysis, which is a study that brings together and analyzes many other studies involving thousands of patients. The conclusion was clear. An interarm difference greater than 15 millimeters of mercury is associated with a significant increase in the risk of death from cardiovascular disease. I'm not talking about a medical curiosity. I'm talking about a signal that can be detected with a simple gesture at home with your device without spending anything. In real life, Mrs. Fatima, 68 years old, a retired cook, came to visit me because she had seen a video about health and was curious. She didn't feel anything. No symptoms, no chest pain, no shortness of breath, no dizziness. We measured the pressure in both arms. In law, 138 by 82. On the left, 116 by 74, a difference of 22 millimeters in systolic. That lit an alert in my head. I requested a Doppler ultrasound of the subclavian and carotid arteries. The scan revealed significant plaque in the left subclavian artery, which was reducing blood flow to the left arm. She didn't feel anything because her body wisely created collateral circulation, small vessels that bypassed the obstruction. But the sign was there. And where there is plaque in one major artery, there is a risk of plaque in others. We started an aggressive preventive treatment, adjusted her diet, and today she is well. But if she hadn't measured both arms, if she had continued to measure only the right, that sign would grow silent. The number told the truth that the body had not yet screamed. And this discovery leads us to the next mistake, which is even more subtle, even more everyday, and which will mess with something that you probably take every single day. The sixth mistake is to measure your blood pressure after drinking coffee or black tea. And here, I'm not talking about cutting the coffee out of your life. I also drink coffee. What I'm saying is that the timing of measurement in relation to coffee is crucial. The new element is caffeine, a molecule that is an antagonist of adenosine receptors in the central nervous system and blood vessels. Adenosine is a substance that your body produces naturally. It accumulates throughout the day and signals tiredness, inducing relaxation and sleep. It also relaxes blood vessels, allowing blood to flow with less resistance. Caffeine blocks these receptors. It takes the place of adenosine without activating the relaxing effect. The result is that you become alert, the vessels constrict, and the pressure rises. The common mistake is to think that, as coffee is a daily habit, measuring the pressure after it is normal, that is already your real pressure. It is not. Its real pressure is its basal pressure, without acute interference. Measuring after coffee is like taking your body temperature after getting out of a hot shower. The real physiological mechanism was unraveled in a study in the American Journal of Clinical Nutrition, a journal of very high impact. The researchers showed that 30 minutes after ingesting 200 milligrams of caffeine, the equivalent of a large cup of brewed coffee, a mug of those 250 milliliters, the systolic pressure can rise from 8 to 12 millimeters of mercury. This peak can last up to 3 hours in people with slower caffeine metabolism. And here's a crucial point for you who are over 50. Caffeine metabolism is done by the liver, by an enzyme called CYP1A2. With age, the activity of this enzyme tends to decrease. This means that caffeine stays circulating in your blood longer than it did when you were 30. If you drink your coffee at 7 in the morning and measure your blood pressure at 8, it's quite possible that caffeine is still exerting its maximum pressor effect. The connection with real life is the routine of millions of Brazilians. Coffee is sacred. The smell of coffee brewing in the morning is a ritual. And I'm not here to take that away from you. But the measurement needs to be taken before coffee, or at least 3 hours after the last cup. Mr. Antonio, 59 years old, a retired bank manager, did not understand why his blood pressure in the morning was always 150/90, but in the afternoon, when it measured again, it dropped to 130/80. He thought the device was broken. He measured right after the reinforced coffee, an entire pot that he drank alone while reading the newspaper. We adjusted the measurement time to before breakfast as soon as he woke up, still fasting from everything. The actual morning pressure was 132/82. This avoided an unnecessary increase in the dose of the antihypertensive drug he was already taking. He didn't have to stop the coffee. He only had to change the order of events. And this paves the way for a mistake that most people make inside the office and that no one corrects, because the appointment is too fast, talking during the measurement. The 7th mistake is talking while the device is working. And I need you to visualize what's going on inside your brain when you speak. The new element here is the activity of the prefrontal cortex and Broca's area, which are regions of the brain that light up like lights when you formulate a sentence. Speaking is not automatic. Speaking requires motor planning. It requires searching for words in memory. It requires emotional processing of the content you are saying. All of these brain areas, when activated, project into the hypothalamus. The hypothalamus is the command center of the autonomic nervous system. It receives the message that the brain is working, and it activates the sympathetic system. The pressure rises. The common mistake is for the doctor or family member to ask something, and the person answers while the cuff inflates and deflates. The doctor asks, "How are things at home?" And you, out of politeness, out of habit, respond. Or your spouse is on the side and comments on something and you retort. That's it. The measurement was contaminated by cortical activation. The actual physiological mechanism involves the motor command of speech, which recruits neuronal circuits from the motor cortex, and the emotional processing of response, which recruits the limbic system. These circuits send direct and indirect projections to the hypothalamus, and from there the order follows the intermediate lateral column of the medulla to the sympathetic ganglia, which release noradrenaline into the vessels and adrenaline into the bloodstream. A study in the Heart and Vessels Journal, a Japanese publication specializing in hemodynamics, documented that talking during the measurement raises systolic pressure by an average of 10 millimeters of mercury. 10 millimeters. And it's not just talking. Listening carefully to a question that requires reasoning, such as a calculation or an opinion, also elevates. The brain does not distinguish between speaking and preparing to speak. Just the fact that you hear the question and start thinking about the answer already activates the system. What happens in real life is that you are in the consultation, the doctor puts on the stethoscope, the cuff squeezes your arm, and he asks, "So, how are things at home?" You, out of politeness, answer, "Ah, doctor, it's okay. Only John is unemployed." At this moment, in addition to the activation of speech, you are reliving a familiar concern. The brain floods the blood with catecholamines. The pressure rises. The doctor writes down the number and says, "Your blood pressure is high." Of course it is. You were talking about a family problem while the device was mediating. The technical recommendation, which almost no one follows, is absolute silence during the 30 or 40 seconds of the procedure. Your silence and the professional's silence. If your doctor talks to you during the measurement is not reliable. Period. Now, let's go to a mistake that is in the environment, that is in the temperature of your skin, and that you never suspected: the cold. The eighth mistake is measuring pressure in a cold environment. And here the physiology is relentless. The new element is peripheral vasoconstriction mediated by the sympathetic nervous system in response to cold. Your body has a central mission: to keep the temperature of the core, where vital organs such as the heart, brain, and liver are, at 37 degrees Celsius. To do so, he sacrifices the periphery. The common mistake is in winter, or in offices with very strong air conditioning, the person feels cold, cringes, and measures the pressure anyway, thinking that it is cool to ask to adjust the temperature. It's not freshness, it's physiology. The real physiological mechanism is that exposure to cold activates thermoreceptors in the skin, which are specialized nerve endings. These receptors send signals to the anterior hypothalamus, the temperature-regulating center. The hypothalamus, in turn, orders the arterioles of the skin and periphery to constrict heat, diverting warm blood into the body. This peripheral vasoconstriction increases peripheral vascular resistance, and by the law of hemodynamics, blood pressure rises. It is a survival response. A study in the European Journal of Applied Physiology demonstrated that exposure to an ambient temperature of 15 degrees Celsius for just 5 minutes can raise systolic pressure by up to 12 millimeters of mercury. 12. Imagine an office with air conditioning at 16-17 degrees. You sitting there in a thin shirt, feeling goosebumps, and the doctor measuring your pressure. That number is not your basal pressure. It is its artificial winter pressure. In real life, this means that a person who measures blood pressure on a cold July morning, with the window open, without a coat, may have a completely different value from a measurement taken in a thermally comfortable environment, with a mild temperature. The correct orientation is to measure at a temperature between 22 and 24 degrees Celsius, without shivering, without thermal discomfort. If you are cold when it comes to measuring, put on a coat, warm up the environment, wait for the body to stabilize. Don't underestimate the power of cold on your POTS. And this leads us to a mistake that messes with your most intimate structure, with your rest, and which is one of the great traitors of morning pressure: the bad night's sleep and undiagnosed sleep apnea. The ninth mistake is to measure blood pressure after a bad night's sleep, or worse, to live with sleep apnea without knowing it. And this is a topic that deserves all your attention because it explains many cases of hypertension that do not respond to medicine. The new element is the renin-angiotensin-aldosterone system, a very powerful hormonal axis that regulates the pressure and volume of fluids in the body. This system is profoundly altered by sleep fragmentation and intermittent hypoxia, which is the repeated drop in oxygen that occurs in apneas. The common mistake is to think that high morning pressure is normal, that it is part of the circadian cycle, which everyone has, without investigating the quality of sleep. No, it's not normal to wake up with high pressure every morning. The actual physiological mechanism is frighteningly beautiful and destructive at the same time. During the night, while you sleep, your breathing should be regular and silent. But in those who have obstructive sleep apnea, the airways collapse. The breathing stops for 10, 20, 30 seconds. Blood oxygen saturation drops from 98, 99% to 80, 70, sometimes less. Carotid and aortic chemoreceptors, which are oxygen sensors, detect this brutal drop and set off an alarm in the brain stem. The brain orders a micro-awakening to reopen the throat. The person snores loudly, fidgets, and breathes again. This can happen dozens of times an hour, hundreds of times in a night. At each event, the sympathetic system goes into a frenzy, pouring adrenaline and noradrenaline. The pressure rises in peaks that can exceed 200 millimeters of mercury in the middle of the night. 200. While you sleep, your heart is being subjected to loads of pressure that no heart should ever face. This damages the endothelium, that layer I mentioned at the beginning, and keeps the pressure high in the morning because the system has not had a chance to rest. Study in the New England Journal of Medicine, the most cited medical journal in the world, has already shown that sleep apnea is an often unrecognized cause of resistant hypertension, one that does not go down even with 3 drugs of different classes. In real life, Mr. Roberto, 62 years old, a retired truck driver, took 4 antihypertensive drugs. 4. In the morning, at noon, and at night. The pressure was still in the 160s. He was discouraged, thinking that nothing would solve it. His wife, Mrs. Lucia, who was at the appointment, commented that he snored like a bear and that sometimes she noticed that he stopped breathing and then snored louder. That was the key. We referred them to a polysomnography, the sleep exam. The result: severe sleep apnea, with an apnea-hypopnea index of 45 events per hour. 45 times an hour his oxygen dropped, and his blood pressure skyrocketed. He started treatment with CPAP, that device that keeps the airway open with a slight air pressure. In 3 months, morning pressure has fallen by 40 points, 40 millimeters of mercury. He was able to cut his medication in half, with strict medical supervision. He slept a full night for the first time in decades. He told me that he rediscovered what it was to wake up rested. The apnea was there, silent, damaging his endothelium every night, and the drugs were thrown against a problem that was not of wakefulness. It was of sleep. This brings us to the climax. The last mistake is the most surprising, and it involves the lie of 12 by 8 for those over 50. Get ready, because what I'm going to say now can reset your relationship with the number you pursue. The 10th mistake is to pursue the goal of 120 by 8 without considering arterial rigidity and brain self-regulation. Here's the most surprising mechanism of all. The new element is the J-curve of blood pressure. The J-curve is a phenomenon observed in large population studies that shows something that goes against intuition. Both very high and very low blood pressure are associated with an increased risk of cardiovascular events and death. There is a sweet spot, a nadir, and below it the risk rises again. For those over 50 or 60 years old, with naturally stiffer arteries, this sweet spot may be higher than the famous 12 by 8. The common mistake is to believe that the lower the pressure, the better. That if 12 by 8 is good, 11 by 6 is even better, and 10 by 5 would be ideal. For a young adult with elastic arteries, which expand easily, this may be true. But for you, who are over 50, your arteries may have a degree of stiffness that is invisible to routine exams. Elastin, the protein that gives elasticity to the vessels, is replaced by rigid collagen throughout life. This is a natural process, but it is accelerated by inflammation, oxidative stress, glucose spikes. With stiffer arteries, the heart needs to generate greater pressure to make blood reach the organs. If you lower this pressure too much with medicines, the blood does not reach where it needs to be. The real physiological mechanism is that cerebral perfusion, the amount of blood that reaches your brain, depends on minimal pressure to overcome the resistance of these rigid vessels. The brain has a self-regulation system that keeps the flow constant, but this system has a lower limit. If the diastolic pressure, that minimum, falls below 65 or 60 millimeters of mercury, the flow in the small cerebral arteries may become insufficient to overcome resistance. This is especially dangerous during the night, when the pressure naturally drops. The narrow, tortuous arteries of the elderly offer more resistance. With diastolic pressure too low, blood simply cannot get through. The result is micro areas of silent ischemia, small cerebral infarctions that do not cause acute symptoms, but that accumulate. Each one erases some neurons. Over time, the accumulation of these injuries manifests itself as cognitive decline, slowness of reasoning, difficulty walking, increased risk of falls. Studies such as the one published in JAMA Internal Medicine in 2190, analyzing thousands of older adults, demonstrated that reducing diastolic pressure to less than 60 millimeters of mercury was associated with an increased risk of cognitive decline and cardiovascular events. The J-curve is real. Too low blood pressure can be just as dangerous as high blood pressure. The traitors here are the drugs in excessive doses, prescribed to achieve an arbitrary numerical goal, and the obsession with the magic number 12 by 8. Other silent traitors are seemingly healthy foods, but in your body they cause endothelial inflammation and keep your vessels rigid. Concentrated fruit juices, even natural ones, cause insulin spikes and stimulate inflammation. Wholemeal breads from refined flour that are sold as healthy. Excess sodium hidden in ready-made seasonings and processed foods that you don't even suspect. All of this keeps the endothelium inflamed, the vessels rigid, and the body dependent on higher pressure to perfuse the organs. In real life, Mrs. Iara, 74 years old, a former bank employee, was proud because finally, with the new medicine that the cardiologist prescribed, her blood pressure was 11 by 6. She called her friends saying she was just like a girl, but she started to have dizziness. He thought it was labyrinthitis. One day, she got up at night to go to the bathroom. Her blood pressure dropped even more in her orthostasis. Her brain ran out of oxygen. She fainted and fell, hitting her head on the corner of the nightstand. He fractured his femur. She was bedridden for months. The pressure too low for her stiff arteries reduced brain oxygenation at the very moment she stood up, when the body needs to quickly increase pressure to irrigate the brain against gravity. The baroreceptor reflex, which was no longer so agile due to age and medication, failed. The goal of 12 by 8 or less had become a trap. I'm not telling you to abandon your treatment. Never do that. I'm telling you to talk to your doctor about the J-curve. Ask him, "Doctor, what is my ideal diastolic pressure considering my age and the stiffness of my arteries?" Ask if your blood pressure is not too low. Ask if your symptoms of dizziness, tiredness, and poor memory may not actually be the effect of over-medication for a goal that was not made for you. Now, my friends, I speak directly to you. Look inside yourself for a moment. You are not a number on a device screen. You are not the diagnosis stamped on a crumpled medical record. You are not the sum of the times someone told you that your blood pressure was high and you felt the weight of the world on your shoulders. You are a person who carries a story, who got up early all her life, who took care of people, who faced things that no one saw, who held back tears, who worked sick, who sacrificed your own sleep to watch over the sleep of others. Your pressure is only one of your body's signals, a language, a whisper, and not an irrevocable sentence. What I brought here today is not to scare you. Fear paralyzes. What I brought here is to give you back the power that has always been yours, the power to ask the right questions, the power to sit in the chair, support the arm at the height of the heart, empty the bladder, silence the mind for 5 minutes, measure in both arms, and only then look at the number. And then, yes, having a piece of data that represents something real. Every mistake we correct is a step out of fright and into clarity. If this information touched you, if it turned on a light where there was confusion before, I ask you, share it with the one you love. Not as someone who sends a generic video, but as someone who holds their hand and says, "Look, this here helped me to better understand what is happening to me. It can help you too." Send it to that friend of yours who has been taking medicine for years and has never measured his right arm. Send it to that sister of yours who measures her blood pressure at the pharmacy and leaves terrified. Send it to your father, to your mother, to your neighbor. The knowledge that liberates only has value when it is shared. The content you just watched is educational and is intended to complement, never replace, the follow-up with your doctor. I don't prescribe anything here. I just open the door for you to come into your own consultation with better questions, with a deeper understanding of your body, and that, to me, is the greatest act of care that one human being can offer another.